Malaysia says it's still on track to manage the Omicron wave. That is despite a spike in infections. More than 11,000 new cases have been reported. That's the highest daily tally in more than 4 months. But Health Minister Khairy Jamaluddin says the rise will not strain the healthcare system. For more, Afifa Arifin joins us live. Afifa, such confidence. Why is Malaysia so sure it can overcome the Omicron wave?
Well, in his weekly press conference today, Health Minister Khairy Jamaluddin said that Malaysia had done its best to delay the Omicron waves from reaching its shores as it ramps up its public healthcare systems. Mr. Khairy said that cases are set to rise even more due to Omicron. And the exponential rise was attributed to the long Chinese New Year holiday last week. But while the number of cases have exceeded the 10,000 mark, it will not cause a strain on the healthcare systems as compared to when the country was dealing with the Delta variant in October last year. He also noted that the number of deaths, as well as those who need treatment in intensive care units, are much lower compared to the Delta wave. And the reason for this, he said, is of course that more people have received their booster shots, which increases their immunity against Omicron. Now, the Health Ministry has also proactively put in place measures to ensure high preparedness to face the Omicron wave. This includes reactivating the COVID National Rapid Response Task Force, which will be deployed to control transmission in a state or an area where there is a surge in cases. This could mean adding more beds and building field hospitals fast if necessary. Additionally, to live with this Omicron wave, those who test positive for COVID but are asymptomatic or just with very light symptoms need not go to the COVID assessment centers in order to avoid congestion. So they just need to self-test and isolate for 7 days. And only those with serious symptoms or those considered vulnerable or in high risk will need to then go to the COVID centers. Now, the Health Ministry also said it is procuring antiviral treatment for serious cases. But meanwhile, the current SOPs in Malaysia still stand, and the Health Ministry also encourages employees to work from home. The Health Minister Khairy Jamaluddin said that the Health Ministry hopes to overcome this Omicron wave within a month or two, as long as the SOPs are followed diligently. So let's listen in to what else he said earlier.
So our view right now and the policy of Kementerian Kesihatan Malaysia in mitigation is to ensure that as long as the public health system is not inundated, is not paralyzed, and is not even close to collapse, then we can deal with the Omicron wave with the strategy and tactics that I have announced today.
Well, Afifa, of course, Minister Jamaluddin's confidence also boosted by what he feels are better vaccination rates in Malaysia. Where are we now on current vaccination rates?
That's right. As of now, 53% of the adult population have received their booster shots. But of course, Health Minister Khairy Jamaluddin is encouraging more people to go get their third dose. The vaccination rates for teenagers are also rising, so that's a positive sign. And so far, more than 18,000 children have also been vaccinated. But for senior citizens above 60 who are considered high risk and vulnerable, Khairy Jamaluddin said that there are still 1 million senior citizens who have not taken their third dose. And as such, they are able to walk into any vaccination centers to get their jabs. Mr. Khairy also revealed that there are about 3.5 million people who were already fully vaccinated with the Sinovac vaccines but have not received their booster shots. And this is because many of them are quite hesitant towards taking the Pfizer or the AstraZeneca vaccines. And as such, they will be given the option to get a third dose of the Sinovac vaccine. As Mr. Khairy said, that any booster is better than no booster at all. But from 1st March onwards, senior citizens and those fully vaccinated with Sinovac will not be considered as fully vaccinated if they have not received their booster shot and could be denied entry into certain places.
Thanks so much for all that, Afifa Arifin in Kuala Lumpur.